Multiple schools in Southwest Virginia will not have school-based clinics next school year.
Now, the Southwest Virginia Community Health System announced the closure of 8 different clinics through 3 school systems. 4 schools are in Smith County: Saltville Elementary, Chilhowie Elementary, Northwood Middle, and Chilhowie High School.
Virginia High School and Elementary School with Bristol Virginia Public Schools and John Battle High and High Point Elementary with Washington County Schools are also facing closures. News Channel 11's Ethan Offit sat down with both the Smith County Superintendent and Washington County, Virginia Superintendent about what the future holds.
Both Superintendent Keith Perigin and Brad Haga said losing their health clinics is a harder hit than it seems on paper. Haga even describing it as a punch to the gut.
It was a shot to the gut. It was a gut punch. It's really going to hurt us. These type clinics keep our students in the classrooms and keep our employees at work if they don't have to leave to go to an outside doctor's office or something.
We've been working very closely over the last couple of weeks with Southwest Virginia Community Health System to try to find a way that we could be more efficient in the services that they are providing to our students and to our employees. And so we thought we had come up with a pretty good plan on how we could do that. And then a week later, we found out that the program was going to be completely removed from our schools.
Between the 8 clinics, thousands of students and staff were treated within a school year. This
has truly been, in my opinion, one of the most impactful non-instructional things that I've been a part of in the school environment. We averaged about 80 visits per month. We had more than 800 visits throughout the course of the year, and that's a combination of not only our students but our employees as well.
This clinic here saw roughly around 200 patients a month. Having this in a rural community is very important for us.
SVCHS said in a press release that they lost a significant amount of funding from the 340B program. They went on to say that the funding has gone from $2.7 million down to $400,000. Chief Executive Officer Brian Haynes said in a statement, quote, "This was a difficult decision because we know firsthand the value these school-based clinics provide to students, families, and educators throughout our region. Both superintendents want parents, students, and staff to know they are already working on plans to have a clinic available for next school year."
Dr. Perigin and I have talked. I've also talked a little bit with Emory and Henry. There might be some other brainstorming that we could do, maybe some other partnerships with our community stakeholders to provide this service.
We're going to do everything that we can to either work with Southwest Virginia Community Health System to make sure that the program is still viable for next year, but if not, we'll certainly reach out to other potential providers in the area to provide this service.
SVCHS adds that their pediatric partners are still available at their community health centers.